Laura Burnett is the Vice President of Information and Support for Cancer Services Canada. Laura, just remind us how huge the cancer population is in Canada. How many people deal with cancer?
Well, we say that over 1 million people are living with cancer and beyond post that diagnostic period. So it is a huge number of Canadians right across the country.
And right now, how is COVID-19 affecting cancer patients looking for treatment?
Well, we know that cancer diagnosis can be a stressful period for people. So living with that diagnostic period, gathering all that information and coping with the impact of their diagnosis, both emotionally and physically. But on top of that, now clients are also dealing with the complexities of COVID, what that means in terms of their diagnosis and also the impact to their treatment. As well as people really wanting to understand, what does that mean for me? Does it cause me any increased risk, both as a patient and as a caregiver? So there's a lot of information and support needs right now.
And surgeries have been delayed. How are cancer patients being protected from their disease during COVID-19?
And I think each cancer care agency, each healthcare system is working with patients to try and triage them effectively. So it differs right across the country. But we certainly know that the healthcare system is working as hard as they can in these really unprecedented times to provide people with the care that they need moving forward. And at CCS, what we're doing at the Canadian Cancer Society is really working with clients, working with caregivers to make sure that they get the information and support that they need during these times. We absolutely know that with social and physical distancing that's been brought on by COVID, we've seen people being isolated from the systems that used to provide them with support. So family, friends, and sometimes the healthcare system itself. So we've had to make sure that we're reaching out, we're working with them to make sure that they can reach out and get the information and support that they need through our virtual support services.
Because you do have the peer match program, which was so good in real life, but now is it able to be a virtual experience?
We've worked really hard to put our programs and change them so that they are virtual. So what we have available for people is right across the spectrum. If people are looking for information and support, they can reach out to not only our cancer.ca website, where they can get information, but they can contact our Cancer Information Service and speak to people about their experience and ask any question about any aspect of their cancer journey, from prevention right through to survivorship or end-of-life care. And they can speak to people who are knowledgeable and who want to connect about someone's journey. And then we can also offer peer support programs. So we've got a cancer community called cancerconnection.ca, where we have people who go every single day, and there's posts on there 24 hours a day, 27 days a week, about people who are sharing their own experiences and asking questions. And then we also have our peer match program where you can connect over the telephone. So it's an online service now. You can go and you can search a database and find a volunteer who you can then connect with over the phone. So we've got a variety of programs really aimed at helping people feel connected during this time, which I think is so important, and really helping to reduce that feeling of anxiety, making sure people get the information they need and get the support that they need and deserve.
Okay, so it does come down to many surgeries have had to be postponed. Who do you think is suffering the most in these postponements? Which type of cancers?
I think that's really hard for us to determine. Certainly the healthcare system, we believe that they're prioritizing those urgent surgeries that need to happen right away. And really they're working with patients in making sure that the delays that do happen, they're keeping track of them and doing the very best that they can in this really difficult time to try and ensure that patients are getting the surgeries that they need if they are urgent, and then working with them to see how the healthcare system can cope with this demand that COVID is providing them. So they're trying to do the best they can in really uncertain times.
Okay, so your best advice then for the cancer patient who's saying, I just know I need to get into the hospital for a surgery.
I think the best place for people to always go is back to their provider, making sure that they're speaking to their clinical team who have their best interests at heart and who can share with them the most important information about their specific case. It's hard to speak across so many different cancers right across the country. There's so many differences there. But I think people can always get their information from the provider. And certainly if they're looking for general information and support, they can reach out to us on our various programs.
Okay, Laura Burnett, thank you. Vice President of Cancer Information and Support Services, thank you.
Thank you.
Hit subscribe and the notification bell to get our weekly episodes and web exclusives.